Earlier in the show, we learned that folks with diabetes have a higher risk for developing peripheral artery disease. However, PAD can also be difficult to diagnose. Dr. Raj Dave is back with us to explain why that is. Cardiovascular Experts is sponsoring this segment this morning. You mentioned that, yes, this can be hard to diagnose. Why is that?
So peripheral arterial disease classic symptoms I was explaining earlier is patients who have pain in their legs, especially in their calf when they walk. However, 30% of the patients, have atypical symptoms of the peripheral arterial disease. That means they don't exhibit classic symptoms. They may have numbness in their feet. They may have fatigue in their legs. They feel their legs are heavy. Sometimes these symptoms can be misdiagnosed as orthopedic or musculoskeletal condition.
Sure.
We see a lot of patients in our practice that, may have sought, chiropractic advice or orthopedic advice for hip pain, knee pain, and has been confused as somebody having an arthritis, or they feel like that they are just aging, but really their symptoms are from peripheral arterial disease. That's what makes the diagnosis difficult.
Once you do make the diagnosis, what happens from there? How is it treated?
So it's a great invention in medicine. The treatment of peripheral arterial disease. 2 decades ago, everyone who had peripheral arterial disease pretty much got amputated in their life. And the amputation risk was really, really high. Then there was conventional surgery, with a bypass operation. But now we can treat peripheral arterial disease from just a needle hole. It's called invasive procedure, called endovascular procedure. So we can go from a needle hole and we can implant, your viewers probably know a word stent, which is basically a tiny metal tube that we can insert inside the artery that can keep the blockage open. And it's really an outpatient procedure. So these patients come, for example, in our surgical center where they walk in and walk out. So they have their procedure, same day they can go home. So the treatment advances have really made the treatment of peripheral arterial disease much more accessible to a large group of patients.
Well, no kidding. If 20 years ago the treatment was amputation and now it's an outpatient procedure, that's phenomenal. What if somebody has already been told you're going to need amputation? Is that the final say, or do you have any advice?
No, there is definitely not. We always encourage, these patients, those who have been told, and, I've done 10,000 leg procedures in this community and,
Wow.
and saved many, many legs. People come to this area from all over the state and especially from nearby states also to prevent amputation, because there are certain procedures that we can do in patients' foot sometimes below the knee, in these arteries with small devices, micro catheters that can improve the blood flow and can save their lives, save their legs and end their lives too. So it's good to get a second opinion, especially if somebody's been told amputation, because there may be something that can be done to save it.
So encouraging. How can viewers get more information, contact you? Maybe this is them. Maybe you're speaking to them right now.
So they can certainly go to our website. They can call our office and they can easily make an appointment with us, and we'd be happy to talk to them.
Perfect. Well, thank you for being with us today.
Thank you so much.
Have a wonderful Thanksgiving.
Thank you. You too.
As we go to break, we thank Cardiovascular Experts for sponsoring this segment. We'll be right back.